as Dr. Sobotka and Dr. Spelda, Dr. Savolt could inform us about evidence.
Thank you. Good afternoon, ladies and gentlemen. Thank you for inviting me here. And I'll try to follow with based on what was said today so far. I will speak about a prospective database of International Association for Study of Lung Cancer, which is an activity that goes back as far as 1990, when it began, when this association began to collect data about lung cancer patients, trying to improve their situation, as was said by my predecessors. They, after some time, collected enough data. It was tens of thousands of patients, and they used them for recommendation for the 6th and later 7th and even 8th issue of TNM classification. And at that moment they decided that it was enough for retrospective data, and they launched the program of prospective database. It's supposed to be a big one, a really big one, because they are asking centers all over the world to send them the data. We'll come to that later. And the aim is to get the data about every stage of lung cancer, about 10,000 patients in every stage of lung cancer, to make a great database and to use the data for analysis. The clear thing is that it's multicentric. It's based on TNM8 edition and also on the map that was continuously developed, and the final form of it, or version, is 2009 IASLC map. What's the material methods? They're supposed to include newly diagnosed patients with lung cancer. I must proudly say that our small hospital here, thanks to Dr. Horvath, joined this activity, so that abbreviation of thorax UN means thorax team of traumatology hospital in Brno. So we joined the activity, and after giving the informed consent, the patient data could be transferred to the central processing, also after receiving histopathology results. So the process is consent, histopathology result, filling a specific protocol online, and sending the data to Cancer and Research Center in Seattle, in the United States, for processing. That's just to remind us what the TNM classification looks like now. I don't want you to read it because you basically know it, and there's too many letters to read. So just the 8th edition was widened, it's more specific, as you can see. But that's the map that should be used worldwide to describe the patient's data so that they fit from all parts of the world. Now, just shortly, I'll go through the form that is expected to be filled if you want to join the party. And it includes patient characteristics, which are encrypted by you and even by the CRAN. So you send the data that you understand, but they don't know, but they don't understand, and they encrypt them into their own code, so that they can identify the patient, but no one else. Now it includes pre-treatment laboratory values, information about potentially multiple synchronous primaries, disease description and diagnosis, basis for pre-treatment findings, and basics of treatment, T descriptors, pre-operation or pre-treatment, post-treatment, administrators, and follow-up. The follow-up is a little bit up to everyone, every contributing institution. This is how one of the pages look like. Well, it's page number 4, as you can see. So that's it's here for you to see how precise the information are to be sent to processing. That's another one. And that's the way how we do it in our small cancer center, lung cancer center. After we are successful enough of getting a patient to our hospital with proper stage of lung cancer, we'll examine the patient overall with all the modalities we have to and need. We say that they are diagnosed. Then there's a specialist committee that gathers and evaluates the results we got so far and decides about what should we do. Operate, no operate, whatever. According to this committee, the patient is sent to the proper center, place, hospital, and it's decided for operation. Then we operate, and after the operation and after we receive the data from all the places we need, like histopathology and stuff like that, we fill the form and send it to a crowd, and we follow the patient up. Results so far are not very optimistic, but let's call them at least promising. Since 2015, when we first joined the party, or the activity, sorry, we operated on 21 patients. It might be more now, but there's no more data sent to CREP so far, so it might be a little bit more optimistic. I'm not going to explain why it is so, but it is so. And why all this talking to you? There's not only duties you have once you join, there's also opportunities you have. Joining the party, joining the database, gives you an opportunity to basic statistical processing of your own data. They promise you that they will process and give you the results of your data. And also, in some kind or in some way, access to the whole database. It's not that you can ask whatever you want from them and they will give you freely the data of 10,000 of patients. But after permission and after, the process basically, as I understand it, is that you ask a question and a permission of using of their data, and if they consider it valuable, they will give you your their consent, and they will process the whole data, and they will give you the result to publish under the conditions they give or they want. Basically means that you will mention them that they are authors and stuff like that. Conclusions from that. You saw the results of so far research we have here, so I don't need to repeat that it's the most important and dangerous cancer we have around here. But for us the results are, if we have a precise classification in the whole world, we can deliver optimal therapy, we can save lives, and we can definitely decrease the economic burden of our national health care, because we can simply return patients and quickly to their normal life. Thank you.
Any questions that would come in?
there is a possibility to collect data from another hospital and bring it to your hands?
The question is simple, thank you. The answer will be a little bit more complicated. Well, we offered this. We offered our services to other hospitals 2 years ago, or at the beginning of 2015, in that way that if they want to participate, they can send their patients' data to us, and we will process them in the way that we will send them to the CRAB and like fill the forms and do all the paperwork around that. So that's the first half of the answer. And the second is, again, thank you for reminding me. Basically, I was inspired by our colleagues in Taiwan because I didn't find you among the contributors of this database, and I checked it today. Unfortunately, their data come from 2014, so it might have changed during the time. But if you didn't, I would very much ask you if you would kindly join the party, because with your results of 1,000 patients, that means a tremendous contribution to this activity. And it's I think that it's your hospital and the Shanghai hospital, if I understand it well. There are two big centers that can provide so much data that, well, that's my vision, and that's something I would like to ask you. And that's the second half of the answer. The first one is our offering the services to Czech hospitals and kind of call for patients for other hospitals. Thank you.
Any other question from audience or comments? If not, thank you.